The meeting is being recorded now.
All right, great. All right, thank you everybody for coming out to our fourth GBM. This GBM is a little different. Today we're going to be having an info session with Regeneron. So after we do what we usually do when we start meetings, I'm going to hand it over to them to get them right into their presentation. Make sure you stay to the end because we still have important announcements to make about FRC and other events that are upcoming for our chapter. So Rob, you can go to the next slide. So as usual, we're going to start by saying the mission statement. So I'm going to count us off and then everybody's going to unmute and we're going to read the mission statement or attempt to read the mission statement together. So 1, 2, 3. The mission statement of the National Society of Black Engineers is
to increase
the number of
culturally responsible
Black engineers who excel academically, succeed professionally, and positively impact the community.
right. I love to hear that. So Alex, we're going to stop sharing our screen now and then we're just going to hand it over to you and give you the reins for the rest of the GBM. Is that sounds good to you?
Awesome. Thanks, man. All right. Let me know when I can go ahead and start sharing.
You're good to go to start sharing.
All right. Let me know when you guys are able to see my slides.
We can see it.
All right. Fantastic. And then I lost your pictures. Okay. Emmanuel, thank you so much for having me. Thank you so much for having Regeneron so that we can share some information with you all about our organization as well as the potential career paths that we have both locally as well as in the Northeast region. So my name is Alex Steele. I am with the University Relations and Early Careers Department. So my primary function is to partner with the universities throughout the United States to make students more aware of the different, career opportunities and really just what Regeneron does. I've been with the company for 4 years now. Every year has been a challenge. It has been very interesting. It's a very fast-paced job. I see Annika smiling over there. Yes, it's definitely not a cakewalk at Regeneron, but at the same time, there's some really amazing things that are going on. So I'm really excited to be able to share some of that stuff with y'all. So aside from myself, I do have some other members of the team with us here tonight. So I have, actually, I'll pass it off. Uncle, if you could, just go ahead and just do a basic introduction. You're probably going to have to take yourself off mute. Who you are, where you went to school, what you majored in, and what your role is. And then we'll get into a little bit more detail about some of that stuff a little bit later in the slideshow. So Akanshola, why don't you go ahead first?
All right, sure thing.
Hold on, hold on. I know it's close names. We're Akanshola, and then I'll go over to you, Annika. Hold on one second.
Okay.
Hello, I'm Akanshola. Graduated from Penn State. Right now I work at Regeneron as a BPS in clinical drug manufacturing. I majored in pre-med, just to give a background. And I've been here at Regeneron for about 2.5 years.
Okay. And we often talk a lot in acronyms. So that BPS is a biotech production specialist. So we'll talk about what that is in just a sec as well. Now, I don't think Michaela is on. Is Michaela on? Okay. All right. All right, Annika, over to you.
All right, now it's actually my turn. So I'm a junior at RPI. I'm majoring in math and business. And over the summer, I worked in quality assurance drug product, and that's the department I'm still working in right now.
All right, very good. And then Juliet.
Hey everyone, my name's Juliet. I'm a junior biomedical engineer here at RPI. And I worked over the summer and I am still working in GMP editing.
And just recently went through a process of connecting outside of the group, and you're going to be doing something a little bit different starting in January, right?
Yeah, I'm going to actually continue working part-time, and I'm going to be working in a different department next semester. So that's really exciting that I'll still be working for Regeneron because it's definitely a great company. So I'm really excited. Awesome.
Yeah, there's just a little bit of stuff going on right now for Regeneron. So we'll talk a little bit about the work that's happening behind the scenes. But we'll kick things as you guys kind of did with your mission statement. We'll talk a little bit about the Regeneron mission. So I I typically start out the presentation with the fact that, unfortunately, so much of the pharma industry gets a bad rap. You hear this big pharma connotation, and all of a sudden you think, well, these are money hungry individuals. They're just taking advantage of people. Well, I'm here to try to set that straight here, and talk about how Regeneron is different, right? So science has always been at the core of our business, and it's the science that drives our mission. We talk about in our innovative culture, the broad pipeline of products that we have in the works, our leading technology. All of these things are kind of elements of, or I should say, the product of these two individuals right here. So these are our founding fathers. We started back in 1988 with the gentleman on the right-hand side. His name is Len Schleifer. And then on the left, George Yancopoulos came on about a year later. George Yancopoulos is our chief science officer. You might recognize their faces. They've been in the news quite a bit over the past 5 months or so. But also George Yancopoulos, you might have recognized that name because he's the 5th most cited scientist from the 90s. What's great is that these guys are they're scientists by nature and by trade. They're neuroscientists. So it's always been about the patient focus, not about the bottom line. They are also extremely still heavily involved in our organization. As I mentioned, started back in '88. The original agreement was on a napkin over dinner, where they were able to get this $1 million venture funding to start the organization. Since that time, early advisors included 3 winners of the Nobel Prize. If you know the name Roy Vagelos, he headed up Merck for a while. He's also on our board of directors as well. So 1988, really small organization, mom and pop startup, $1 million. You think $1 million is going to go very far? Well, it really does not get you very far when you're talking about this kind of an industry. However, they were able to come up with some nice technology. You see in like the 2000 to 2003, the first TRAP, the first of Velocigene publication, right? So I talk about George Yancopoulos really being, a brilliant mind behind the science that goes into our business. However, any kind of revenue that is really being generated during this time is being reinvested into that research and development. 2008, we'll talk about ARCLIS. It's our first FDA-approved product, right? So you think that's going to at least put us on the map? Well, not so much, because it only impacts about 800 people worldwide. Then 2011 hits. We have an established headquarters down in Tarrytown. Locally, when I say local, I'm talking about the capital region of New York, Rensselaer area. We began our operation here probably in like the late 90s, 97, 98. Well, by 2011, we had about 300 people here. All of a sudden, we get this FDA approval for EYLEA, right? So EYLEA, we knew that it was going to be a pretty big drug. We knew that it was going to be a blockbuster drug, primarily because of what it treats. We'll talk about that on the next slide or one after. So we estimated about $350 million. Well, actually, you can see by the slide, in 1 year alone, it generated $1 billion worth of sales. Now, what's great, and a testament to why this organization is great. We had a monopoly on that treatment at that time. Never once did we raise the prices for that drug. Never once have we raised the prices for any of our drugs. Actually, in a couple cases, we've even reduced the prices. And in many cases, we also have generous access for individuals that maybe cannot necessarily financially meet the needs to receive that treatment. So all of a sudden, we're going on this tremendous trajectory since that time. So I talked about, about maybe 300 or so people in the area at that point. We now have over 3,200 employees in the capital region. So in just, less than 10 years alone, we've grown significantly. And then over the course of the next, 7-8 years, you're talking about several other indications and approvals for various treatments. So by the numbers. These slides get updated every quarter, and it's amazing how quickly they get outdated. So 7 FDA approved products, it's actually 8, because now we just received FDA approval for our Ebola treatment. So you think about Ebola, there's significant mortality. It's a horrible disease. Well, with our product, it's a 90% survival rate, which is absolutely amazing, right? So there was just another Ebola outbreak in the Congo just about 3 months ago, and we were able to provide this. Unfortunately, with the case of Ebola, sometimes it's the challenge is getting the treatment to those patients that are in the greatest need. But we've been able to do that successfully. So we're very proud of that product. Another thing we're very proud of is the fact that 100% of our drug candidates are invented and developed in-house. So we're fully integrated. So whether it be the research and development or the manufacturing, it's all under the Regeneron umbrella. Significant pipeline of drugs that are coming down the works. When I was being recruited to the organization about 4 years ago, the things that really stood out to me is, okay, at that time it was about 6,000 employees, and yet, they're on Forbes, most innovative companies. Science Magazine, best places to work. Fortune Magazine, best, top 100 places to work. The Civic 50 for organizations that are so, dedicated to their community. Most just companies, the organizations that are recognized for doing the right thing, right? So these things, I'm like, wow, this, aside from the fact that they're doing really cool things in the ways of the products that they're making, that must also be a really unique organization to work for. So, I jumped at the opportunity, and I haven't looked back. 8,100 plus Regeneron employees worldwide. It's closer to 9,000. So we have our Tarrytown location, which is our headquarters. We have our facilities in the capital region. We also have a pretty large presence in Raheen, Ireland. All right, so we'll hit on that in just a sec here. So our 7 FDA approved products minus the 8th, which is the Ebola treatment, because again, that just got released about a week and a half ago. All right, we just got the FDA approval for that. Dupixent. So that's the one that you guys may have actually seen a commercial for, right? So Dupixent, you might see there's a woman with her grandson. They're playing softball, and it's like, do more or whatever, right? So asthma is one of the indications for this, but it's also atopic dermatitis and nasal polyps. So that is a drug that is really taking off for us. It has had the ability to help hundreds of thousands of individuals. Kevzara rheumatoid arthritis probably is a cholesterol drug for a hereditary LDL situation. Libtayo is one of our more recent releases, and that is an oncology product. Arcalyst is that drug that I was talking about that only impacts about 800 people worldwide. It's an orphan drug, and it's a disease that it can be really painful. So if there's a fluctuation in temperature, your body responds very negatively, breaks out, and it's very uncomfortable, right? So only 800 patients worldwide. Yet we make that product twice a year to meet that need. We actually lose money making that product. And then we talked about Eylea. Eylea is the one that really put us on the map. That flagship drug. It's wet age-related macular degeneration. So to put it in layman's terms, as you age, oftentimes your body may overproduce blood vessels within the eye, so it's going to cause an obstruction, and basically many people go blind, or they have blotches that they cannot see. Well, this alleviates that and restores that vision. So it's great to hear those patients talking about, oh my goodness, I can see my grandkids, I can actually drive these, so it has a major impact on those individuals' lives. So aside from those, extremely diverse products, you can see from here that our clinical pipeline is made up of a wide array of therapeutic focuses. So everything from oncology to immunology to rare disease. So there's one in here. It's the FOP. If you guys have never ever heard of FOP, it's another term for it is stone man's disease, right? So these poor people, if they receive trauma as opposed to just bruising, that part of their body would actually turn to bone or calcify. And then over time, they end up asphyxiating. They end up dying due to not being able to have any kind of flexibility in their lungs. Horrible, horrible life. So we are in phase 2 for a treatment for that product. Now, Akanshola, I know that you're in mid-scale, right? So you have potentially had your hands on working on some of these products already, right? So anything in particular stand out to you that you're excited about working through these pipelines?
For the most part, the main one that I played a role in is Libtayo. When I first came on, that's something that we're working on pretty continuously, trying to run it through FDA approval. I was actually on a team that worked through with all the regulatory stuff. When the FDA came in, they were like, questioning us, like checking procedures, stuff like that, just make sure that things were going how we said they go, and also like in accordance to their rules and regulations to make sure that it's safe to the people that it's going to, because at the end of the day, everything's patient first, and if it's not doing what we say it's going to do, or if it's not safe for the people that it's going to, they're not going to regulate it. And then also played a part in terms of like more so like paperwork and records and like the back side of things with like some of the Ebola stuff. So that's about it.
So it is important to point out. So Akashola, he was talking about the fact that we really have to validate everything that we are making. So you think about what we do. We make biologics. It's not just a pill. It's not just a topical cream for atopic dermatitis. Everything we make is an injection into our patients. In many cases, it's in the eye, right? So we have to be very prudent as to how we make that product. So the Libtayo drug is our oncology drug, and it's for a terrible type of skin cancer. Where often the only treatment up until this point was to cut it out of a person's body. So you'd be taking off a significant amount of skin and often bone as well. So really horrible type of cancer that we've been able to come up with this tremendous treatment for. All right. And I failed to say, you guys, like, feel free to interject, ask any kind of questions, or use the chat. I can't necessarily see the chat as I'm presenting or sharing my slides, so feel free to call anything out. Happy to answer anything as we walk through this. I prefer more a dialogue as opposed to me just spewing information at you. So feel free to interject. All right, we talked about some stuff with Ebola. As you guys may have seen in the news, we are, hey, by the way, we're working on a COVID treatment, right? So it's our antibody cocktail. As soon as actually even before we were pushed to working remote, right? So this is my garage, my setting. Annika and Juliet, they're accustomed to seeing me in this setting, but I have been on site. I could tell you that during the day, I have been on site quite a bit. But right before we were sent to remote, this is one of the things that originally, became our top priority. So I mentioned we have a facility out in Raheen, Ireland. We have been able to take any kind of, probably about 80% of what we're producing here in the United States and transfer it over to Raheen for them to ramp up production so that we can dedicate all of that space, allot that space to our ramping up the antibody cocktail for COVID. So we have an agreement with BARDA. You can see that the acronym there with the MERS and actually in both and the COVID-2 on the right. So this has allowed us to be granted $450 million to work through that process. So you think about it, it's a significant financial risk. All of these on the previous slide, right? Any one of these has a tremendous risk of failing, right? So many products do not make it through all the clinical trials, right? So it's a huge financial risk for an organization whenever they're doing some kind of a launch. So this $450 million has allowed us to mass manufacture this product all the way through 1, 2, and phase 3 trials. So right now we have over 50,000 doses ready to go, and within the next 2 to 3 months, we're going to have well over 300,000 doses ready to go. All that information about what we're working on for anti-COVID is available on our website as well. So if you just go to the Regeneron.com, there's a specific site within that dedicated to all of our work for COVID. Mentioned that we are fully integrated with our Tarrytown location. We work very closely for the handoff. Actually, Akinshola's group there in mid-scale manufacturing works very closely with a group called PMPD, or you see there in the bottom right, the preclinical manufacturing process development. But if you are ever interested about the science that goes on or how we work through our process, because the Velocis suite, we call it, the Velocis suite of technology is what allows us to work through the clinical trials much faster than any other organization. So again, in layman's terms, what we've been able to do is emulate or replicate the human immune system within mice, right? And so it allows us to work through things in a much safer capacity. And all of that information is available on the Regeneron.com. If you go to the science tab, there's about 5 or 6 2-minute videos with animations, which makes it really easy to understand the very complex process that is behind what we do. All right. Locally, we are what we call IOPS, the Industrial Operations and Product Supply. Again, another terminology for manufacturing. So we have about 3,200 employees in the area. I would say, close to half of them are either in Akinshola's group, mid-scale manufacturing, or in what we call our large-scale group. And those are the individuals that are working on our FDA-approved products. All of the other employees are those support functions: quality control, quality assurance, process sciences, manufacturing sciences and technology, continuous improvement, delivery systems, drug product engineering, also known as combination products, right? So there's various other groups. So I can tell you that, while we do a significant amount of hiring for, engineers, biomedical engineers, chemical engineers, the individuals with the sciences, biochem or biotechnology, there are various other functions that we need. So, like, for example, I was a business economics major, right? And I found a home within university relations or human resources. And I can tell you that aside from the 3,200 employees that are here now, because of what's going on with our success of our products, as well as with the growth that we're going to see due to a new element of the business that's going to be coming in, we're probably going to be close to 4,000 employees within the next 3 years. Okay, so a lot of opportunity for growth, both to get within the organization as well as to move up within the organization. About 720,000 square feet of production lab space. Now, I mentioned there is that one element of the business that we do not do yet, or that we're bringing into the organization. So it's fill finish, right? So right now we kind of stop our process at a certain point, and then we work with external manufacturers to fill our product, fill whether it's the pre-filled syringes or whatever it might be. Well, we're going to be able to control that or have that process pretty soon. Why would we want to do that? Now, Akashila was talking about, safety and efficacy, right? That's one key element. It's also with being able to control the process when there's fluctuations of need at some of those filling plants, right? So, Miriam, I'm looking at you. It's the fall right now, right? So, I'm putting you on the spot. I'm hoping that potentially you have received a shot or you're scheduled one, right, for whether the past couple of weeks are coming up here, right? What is this time of year notorious for?
Flu season.
Very good. Thank you so much. All right. So if flu season, so these filling plants, that's going to be their demand, right? All of a sudden they're going to say, okay, well, Regeneron, we're going to put you down the list a little bit so we can make sure that we get everybody the flu shots. Well, we need to be able to accommodate or account for that lapse, and so that's one of the great benefits of that fill finish facility. Okay, so 720,000 square feet of production space. It's actually going to be closer to over 1 million within the next year, because we're building a 300,000 square foot facility, investing over $800 million in this. So it's going to add a lot of space, but also we're going to need to fill that space with employees that are going to be able to work through that process. I talked about Raheen, Ireland. What's been great about having Raheen is, again, we talk about that ability for them to take on a lot of that transfer to still produce that Dupixent that our patients need, or that Eylea that our patients need, Praluent, all that kind of stuff. Also, it allows for an opportunity for us to deal with a lot of the regulatory agencies that are outside of the U.S. and for distribution purposes to the EU and other countries, whether it be in Asia or Africa and so on and so forth. Okay.
Excuse me, Alex. I have a question.
Go for it.
Hi, my name is Christian Frankis. I'm a chemistry major, senior here at RPI. Sorry for interrupting. I couldn't raise my hand through my phone.
No worries, Christian.
So I just had a quick question about, since you're talking about your company expanding so much, I was just curious, were you guys ever considering, I don't know if you guys can provide this information, on expanding your company to a different country soon? For example, I'm originally from Puerto Rico, and Puerto Rico is known for being a huge spot for pharmaceutical companies. So I was wondering if Regeneron had thought about expanding, not specifically to Puerto Rico, but any other country in the near future.
Well, we got Juliet on the line, who was actually doing a lot of her summer internship in Puerto Rico.
So actually, Juliet is my girlfriend.
Totally called you out right there.
Yeah.
We actually, interestingly enough, we recruit a lot from Puerto Rico. We have a number of people that I know that are working in our quality assurance department as well as in process sciences. Now, we do not have plans to specifically build outside of the U.S. though currently. Now, I mentioned Raheen, Ireland. Mm-hmm. We have some facility in Uxbridge, as well as I might have it on here. And Dublin. All right, so just those locations in the Ireland area. But as of right now, so there's by starting the organization in New York, we've actually like Len and George are from New York. They were born and raised in New York. They're very passionate about being able to keep it in state. The majority of the organization, doesn't mean that it never will branch outside of it. And as the company continues to expand, we talked about the benefits of having Raheen for flexibility and for distribution. But also this company it still has like a mom and pop type of a feel to it. And I think that they kind of want to retain that. So I think that there will be an element of, okay, we're not gonna grow outside of our means, that kind of a thing. So it's I'm not saying that it's completely out of the realm of possibilities, but it's not likely, at least in the near future.
Okay, thank you.
Cool. Yeah, no, thanks for the question. All right. I'm going to pass this over to Akinsholo a little bit, because he's the man behind the scenes here. He's actually in the process area and kind of hands-on doing this work. So this is what happens here at IOPS. I like these cute little pictures. It's nice visual. I'll let him talk through some of the science behind it. Unfortunately, it doesn't give you the appropriate scale that we're dealing with. All right, so I'll let him do his spiel, and then I'll kind of give you guys a little bit of sense of perception. All right, go ahead, man.
Hello, everyone. Okay, so start off at point number 1. That's where we basically get our cell line from like process sciences and stuff like that. We'll get our cell line. It'll be a small vial, about like 4 milliliters or so, and then our C-train team will take that. They'll basically like thaw it, then incubate it in like wave rockers and stuff to grow the cells like over a span of a couple weeks, and then after that, they'll basically take it 4 milliliters to about a 20 liter wave rocker, and from there they'll take it to our bioreactor team. Our bioreactor team will transfer that into a big stainless steel or single-use bioreactor, where they add like different feeds and medias, and then over a couple weeks, about like 2 weeks, they'll basically add oxygen and basically all the other stuff that's needed in order to grow it. And then at step 4, that's where my team comes in for purification, where we take the harvest material from the bioreactors. We'll take it through various steps of chromatography, column chromatography specifically, and we basically run it through different phases through the resin beads in order to either bind the protein or bind the impurities. That way we're removing them and taking away specifically what we want. Then from there, we'll bioinactivate it. We'll put it through more chromatography. We'll filtrate it out to get rid of potential harmful objects and like DNA and stuff. We want to get rid of all that just to retain the protein. And then we'll play with the concentrations through ultrafiltration, diafiltration, in order to get the exact filtration we want. We'll formulate it, and then we'll dispense them into like different bottles and stuff depending on the specific drug, based upon those concentrations. And then from there, we'll ship it off to get it labeled and packaged to those small vials that we are now currently working towards having in house.
Awesome. So again, I mean, it's hard to get a visual understanding of like the scale or engineering that goes into this process. Now, typically this takes about, for a drug to work through that process, what, about two months or so?
Yeah, about 2 months. So like, as I said, the seed train stuff will take about like 2 to 3 weeks, depending on how the basically how the cells are working, the viability. If like, let's say, if y'all have worked in labs, sometimes cells just don't cooperate. They'll die off and stuff like that, and you can't use it, you got to throw it away. And even at the bioreactor, sometimes like the cells will just say no. Yeah, in bioreactor and seed train usually takes the longest. For us through purification, depending on what molecule specifically, it'll take us about a week, maybe a week and a half, depending on what we're doing.
Okay.
And just to help y'all a little bit more with the scale, it's going from that 4 milliliters to about 2K bioreactor. And from the 2K bioreactor, we're taking it down to about 200 kgs. And then we're scaling that back up to about 1,000. And then we're filtrating it and concentrating it down to about 50 kgs of material, and then dispensing that.
And that's on the mid-scale side, right? So that's on all of the clinical products, right, that are working through our trials. Now, if you're talking about the FDA approved products, that's our large scale group, and then you're talking about a bioreactor that's 10,000 liters, right? So how big is 10K, right? So a 10K, if I had to guess, is roughly about 30 feet across and almost 2 stories high, right? So these things are absolutely massive. So, some of you guys that are in chemi or BME and stuff, you might have had some opportunity to do some desktop stuff. This does not fit on a desktop, obviously, right? So it's massive, and it's really difficult to try to give you a visual picture until you've actually had the chance to walk around one of our process areas. So, Annika and Juliet, I think you guys, I pushed you guys out the virtual tour. So hopefully you guys took advantage of that. It was really cool because that actually puts you inside one of the process areas, and you can do like a 360 around, get everything checked out. Okay. All right. Now we talk about core values or organization, and too often what it is it's just writing on the wall that an executive said, you know what, Annika, you should abide by these, or this is what you should act like, or Fiona, how about you? Take a look at this, make sure that this is the kind of the story that you're telling to our clients. And that's not the way that it works at Regeneron. So the thing that I really like about it is that roughly about 2-3 years ago, our organization reached out to the employees, and they said, Juliet, fill out this information. We want to hear from you. Tell us about the things that you feel are really important to our success. What's our work like? And this what you see right here, this Regeneron Way, just kind of materialized from that. So we have our 5 buckets: to lead with science, take on big ideas, make it happen, be great together, and do what's right. And I can tell you that, all of the things that make up those buckets. So whether it be the innovation, right? So we're an organization that is driven on innovation. So what happens with that? You're going to fail a lot, and if you don't have that fortitude or perseverance, you're probably not going to be set up for success in this kind of organization. Make it happen. You have to, just think about what happened most recently. You guys have demonstrated a lot of flexibility in shifting all of your work to remote. Well, think about in our industry where we're trying to solve this societal problem that's happening with COVID. Being great together. If you want to be in a lab setting, close your eyes, or put your head down and just do your work by yourself. That's we're extremely cross-functional, very fast-paced, and so it's probably not going to be a fit for you, right? So. When I say about the Regeneron Way, it's not like, oh, this is the way that it should be for all of you. What I'm saying is, if you guys don't see yourself in this, then it may not be the environment that's going to set you up for success, and that's okay, because there are, organizations have their own culture. This just happens to be ours, and it's the one that has really stood out to me as being a place that I feel comfortable with. So when I'm interviewing candidates, traditionally about half of the questions are going to be geared towards, Emmanuel, can you do the technical needs of this job, right? Do you have that educational background? Do you have some experience that's going to put you up for success? At the same time, we're going to train you a ton, and on the job, you're going to learn a lot about doing that job. So a lot of the questions that I'm going to focus on are going to be more about, are you going to fit into this environment, and is it going to set you up for success, right? So, Annika, over the course of the summertime, right? What were some of the things that maybe stood out to you as to how were you able to get a sense of the Regeneron Way, even working remotely as an intern?
I definitely was, even working remotely. I wasn't on site at all. I've never stepped foot on site. Well, except to see the outside, but I've never been in the building. And I've seen every single one of these 5 buckets, every single day, especially the Be Great Together. There's not a single day that goes by where I'm not reaching out to someone else for help, or someone's reaching out to me for help. I work with different departments. I work with quality team over in Ireland. So that one really resonates with me a lot.
And it's not just, it doesn't always have to be these huge, massive things, right? So you look at the do what's right in safety and quality. I'll give you an example. When you come on our site, speed limit in the parking lots, you cannot go over 15 miles an hour. There's actually signs that will start flashing at you if you're getting close to 15 miles an hour. And then what you have to do is you have to back into your parking spot. Why would we back into our parking spots? There are studies show that after a day of work, you are fatigued. You are not totally, mentally there, right? So there's more accidents or more opportunity potentially that you could hit somebody if you're backing out of a parking spot. So you back in when you're most awake, so that as you leave, you're just pulling out and easing out of your spot, right? So that's a minor thing, but that's just a quick example of what it's like to all of these things that are in play to make sure that all of these values, this Regeneron way, is always being I don't want to say driven home, but lived. Okay. All right. So with that, I'm actually tomorrow. I'm participating in a volunteer activity. We have a huge involvement in the community. We have over 150 different organizations that we actively support. But as an employee, you can have something that you're passionate about that we will absolutely be able to help you support as well. Every one of our employees, outside of just this Day for Doing Good initiative, gets 8 hours per year to use to volunteer on their own, where you still get paid. It's called VTO. And so over 1,600 hours in 2019 alone by our employees dedicated to the community, everything from the Ronald McDonald House to the American Cancer Society to the Girl Scouts of America. Tomorrow, what I am doing for every one of our different groups gets to partner with one of these organizations. Ours is with service dogs that have been retired. So we're building, we're making beds for those service dogs for their forever home. And of course, it's a play on words, FURR, forever homes.
Alex, I'm doing that one too tomorrow.
You are?
No way.
Well, like I said, I mean, Bobby's, she's right down the hall from me. So sometimes they'll partner up groups that are close with each other. So I'm looking forward to it. So tomorrow afternoon, we're all going to virtually connect. We're going to build our dog beds, maybe have a glass of wine or two, and enjoy some fun. So anyway, careers. All right. So have any of you guys heard about Regeneron before and potentially applied to any of our positions? I see nodding heads for heard about us. Anybody apply to internships or full-time opportunities as of yet? Annika, yes. To hear. Okay, very good. So we have the largest internship program in the capital region. Last year, we had 134 interns. Very, proud to be able to retain that 134. They were all remote due to COVID and the nature of the work that goes on in our business, but we are still going to be expanding that for 2021. Looking in the ballpark of about 150 to 160 interns for that. Down in Tarrytown, we have about another 300 or so. And right now, we are actively recruiting our candidates, right? So we've been doing a lot of virtual career fairs and speaking engagements like this. But as you can see listed here, there's a ton of different opportunities that are available. So everything from your BME to ChemE all the way down to business, finance, and accounting. So the thing we've done this year is we've actually grouped them by major. So you're not applying to a department, you're not applying to a project. This just allows for it to be a lot more seamless for you, as well as for our managers to then say, okay, I need a chemical engineer with maybe Python experience. Maybe they're a sophomore, right? So we'll have a bucket of those for them to go into to pull out that candidate, and then to start the interview process. Now, because of the growth of our internship program, as well as the applicant pool that we've seen, the whole President Trump going on the news saying that he received our antibiotic cocktail, that had a little bit of an impact on our employment brand. People started to recognize us a little bit more. So our applications are up probably twice as much as they were last year. So we're working through all of those applications right now. So if any of you have applied, we apologize for the delay. We appreciate your patience. But we hope that many of you that have applied have received an invitation to do a video interview, which is like, you're recording yourself. From there, that gets submitted. We review that again, and then we put those individuals that are moving forward in front of the managers for consideration. They then pick those. They're probably going to start making their selections early in November, so within the next week and a half to 2 weeks, and then final round interviews will begin. So we do hope to still make many selections and offers before 2021, but because of a rolling process and the volume, some of it's going to go into the beginning of 2021. At least for us, for the Tarrytown location, much of that will go into the 2021, because again, they have like 300 interns. It's just a little bit more challenging to work that in a very efficient process. So we have Juliet and Annika here, hoping that these guys can shed a little bit of light about their experience with us over the summertime. The one thing that I do want to say is that you are doing tangible work, right? So each of our interns is challenged with a project that at the end of the summer, you have a defined deliverable. Usually that's realized in presentations to your department, sometimes the senior leadership team, as well as a poster expo where you get to showcase that work. So Annika, if you could talk a little bit about the project that, well, I mean, you're still, doing some active stuff on it, but, what was the primary responsibility of the chat?
So basically for my project over the summer, I went through all of our batch records with one of our external manufacturing organizations, like Alex was talking about. And I looked at those batch record comments that get sent back and forth from us to them. And basically I was working on trying to make the overall process of that comment resolution more efficient. And kind of seeing what types of comments they were, what type of conversations we were having with them and errors we were seeing. And so it was actually a lot more responsibility than I thought it was going to be coming into it. I was like, I'm an intern, I'm the bottom of the totem pole. And then I got here and it wasn't like that at all. My manager was kind of like, here's what you're doing, go with it, be creative. So yeah, it was an overall awesome experience. Like Alex said, I'm still working on that project as well as a few others. Yeah.
And I can tell you, you're the epitome of a summer intern project in that, you're going to have certain skills, foundational skills to do well, but you're not going to know everything about how to do the project right. We're going to stretch it. We're going to challenge you. We're going to push you. That's the whole. There's real two main objectives of an internship is to grow as well as to get a foot into what it's like within the industry, right? So, we're definitely going to provide you with both of those so that you can then either self-select in or say, you know what, that was a really cool experience, but I want my career to go in a different way. And these are the reasons why this is what I found that I really love, and I'm going to take it and go with that. The things we can teach employees a lot about how to do the job, but we can't teach enthusiasm. We can't teach passion. We're just hoping that you'll get something out of it that is going to be that little nugget that you're going to be able to take and run with that you find valuable. So, Juliet, how about you? Can you talk a little bit about your project?
Yeah, of course. So, project was with GMP auditing. So overall, I created over 15 different sets of documents or work instructions that specifically narrated how to do specific auditing procedures, such as making comments letters or acceptance letters, or just formulating internal audit responses. And this overall is going to save the GMP auditing team a lot of time because they can just refer to these documents if they have any questions and just follow these specific procedures instead of asking around. Currently, I'm still working on a pretty big work instruction that's a lot of pages long, and it's pretty much just talking about the quality management system, sort of like a compliance system for their documents and how to navigate it. And yeah, it's exciting because these documents are going to be official documents in the future, and we're also in the process of reviewing them so they can go into a workflow and officially and be official documents. So it's really exciting how you can do something impactful that a lot of people in the company are going to use to their benefit. So you're actually doing tangible work, as Alex said. And yeah, so that's what I've been doing, and it's really great. And as I mentioned previously, I'm going to continue on into a different department. So that's something I really loved about Regeneron. I had mentioned to my boss that I was interested in continuing doing part-time work next semester, and she told me that it was definitely an opportunity. And yeah, I reached out to different people and I got this opportunity, which was really exciting. So Regeneron is really an amazing company to work with.
So, it's great that you're talking about that project work actually making an impact. The one thing that I love is if an intern ultimately comes back as a full-time employee, they get to see how their project work was fully implemented and everything, and really did have an impact on the business. I talked about Kevzara being a rheumatoid arthritis drug. We had interns from 2018. They did a human factors experiment. You think about rheumatoid arthritis. I might not have the dexterity to grab this pen, so I couldn't self-administer that kind of a product. So they worked through designing a product that was more like fitting into the palm of your hand, easy to administer, and a device was selected that was very close to what they worked on and is now actually operational and it's being used by those patients. Pretty cool stuff. Also, Juliet, you're an epitome, or you're a demonstration that one of the things that we try to do as the university relations team is to build out that summer experience. So you have that project work, but we're gonna provide you with elements of our culture, with access to leadership, speaking engagements, and everything. The other thing is access to networks, right? It's up to you to actually leverage that, but we're going to try to provide you windows into what it's like to work in process sciences or quality control and others, so that maybe that following summer you can work in a different location. So like Annika might actually be working in a human resources function next year, and Juliet potentially, in the springtime, she's going to be doing something in delivery systems. So it's great that you guys took advantage of the opportunity to look outside of those groups as well and learn even more about the business. Okay, so on over to full-time stuff. Axel was talking about, he is a BPS, right? So on the right-hand side there, you see a biotech production specialist. That is probably the number one, not probably, that is the number one position that we hire to for recent graduates that are coming right out of an undergraduate degree. Anything from your sciences, your biochem, your chem, your biology, to your engineering, chemie, BME. That's probably the top majors that we draw from for those positions. And that's you are doing the process that Conchola talked about. He was mentioning how a lot of these deviations, the pH can change, the temperature. We're making these products. It's not just from 8 to 5. This is a 24/7 role over the course of those 2 months or whatever that we're making that batch. So we have people that are working first, second, third shift. We have a lot of times now it's a 4x10. Actually, what is your shift?
So my shift is 4x10. I started off on like regular 9 to 5, 5 days a week, but then we switched over to 4x10s so that our shift is able to to support 24/7 and also to make like double batches to run like 2 different sets of the molecule at the same time.
And are you doing a weekend shift as well, or is it just during the week?
I do during the week, but for me personally, all the new people have came in, so like they'll ask me to come in. Like tomorrow I'm going in, and I'll be there probably like either Saturday or Sunday also, just to help train up people and just push things along. And
so like a lot of the recent graduates like the BPS role because of that 4x10 shift. You get that extra day off. You get some, especially if you're doing like a Sunday or a Saturday, you get some really nice differential pay. Students that are coming out, you qualify for the loan payoff program. So we would provide $100 per month towards the principal of your loan. So while Miriam, if suppose you have student loans and you're paying $300 a month, right? That's not going to change. It's still going to be $300 a month for you. However, the amount of time that it takes for you to pay off that loan is going to be significantly reduced because that $100 is going right towards the principal of that, which is really cool. And if anybody wants to come into the organization and they want to continue their education, we have a tuition assistance program as well. So oftentimes, like an engineering student will be like, all right, well, I'm going to go into manufacturing and I want to get on to a leadership track. I want to be a people leader. So I'm going to go for an MBA. They can go to school while working and get up to $10,000 per year reimbursement. And then once they get that degree, they get another chunk of change. Oftentimes, it ends up being like a wash, like nothing out of your pocket. All right, so some very nice perks and benefits, which we're running out of time, so we're not going to necessarily hit on all that stuff. But if you guys are interested in full-time opportunities in Rensselaer, they're on the right-hand side are the 3 primary ones that we talked about. That BPS Process Sciences Associate is more of like a chemical engineer or biomedical engineer focus. Working with the manufacturing group on efficiencies, deviations, and such. QC analyst is definitely going to be more on that purification side, so the biochem or the chemistry. Tarrytown, we do have some early career roles there. They do not do as much early career hiring as we do in the capital region. We have about 40% of our positions are just geared towards students with an undergraduate degree, whereas Tarrytown, many of their positions are a little bit more PhD or master's oriented. If you are looking for full-time, the full-time opportunities that are on the job board right now they're basically like we would call an immediate need. They're there because we have a vacancy to fill. So realistically, we're looking to fill those within like say 90 days or so. So if you're not graduating until May, it wouldn't necessarily make sense for you to apply now. More along the lines of like February, March, that's when we'd be able to get you in consideration for that. Whether it be our intern positions or whether it be our full-time roles, everything is posted on careers.regeneron.com. Very easy to filter. Just filter by location, or filter if you're looking for an internship. Just type in intern, and you can see all those different majors that we're supporting for that intern program. Note that the intern program postings are probably going to come down within like the next 2 weeks or so. So if you are interested, I would highly recommend that you apply soon. Okay. Annika, Juliet, these guys are what we would call our campus ambassadors, right? So our CAP program. I'm the old guy with the white beard telling you about how great Regeneron is, right? So, but these guys, they lived it from your student's perspective, right? So I would put a lot of value into what they have to say. So if you're not comfortable doing it during this call, if you're not comfortable doing it during this call, I would, I'd highly recommend going on LinkedIn and seeing who you might be networked with at RPI or other schools, and connect with them outside of these groups. Just you can look up hashtag Regeneron Campus Ambassador, or Create the Future You Believe In. All these things will provide you some feeds like this and let you know who you might be able to reach out to about any kind of questions that you might have for what it's really like to work at Regeneron. Okay. And again, while it is coming from the company perspective, I do highly recommend that you follow Regeneron. We've been in the news a lot lately because of what's going on with the antibiotic cocktail. There's some great stuff happening, like again with the treatment for Ebola, the exciting things that are working through the clinical trials. So I would assume there's going to be a lot more announcements over the course of the next couple of weeks and next couple of months about hopefully things that are going to have a significant impact on our current environment. All right. So with that, I know I always say let's have this as being a dialogue, and then I end up talking the entire time. So I want to make sure to answer any kind of questions that you guys might have, whether it be me, whether it be Akinchola, Juliet, or Annika. Is there anything that you guys had that you wanted to pose, or just curiosities that you have about Regeneron at all?
I had a quick question.
Go for it.
Back on the internships page, beneath finance, I saw that you guys had internships on law. I was wondering if you guys mainly handled bioethics cases, or generally, what would a law intern at Regeneron encounter?
I mean, it's full house counsel. So we are actually going to have a legal intern both in Rensselaer and in Tarrytown. I'd have to look up the project specifically, but oftentimes it's ranging. So like I work with house counsel on the content, like so Juliet and Annika, they did their poster, so we had to get legal review to make sure that anybody could see the content that they were depicting on that poster. So that's just one minor example. Everything from that to more serious things where maybe a patient may make a claim that our product made them sick as opposed to healing them. So really ranging. But the intern itself will, again, the internships are project-based, but while they are project-based, they are also experiencing a lot of other things that are going on within that group, getting exposed to a lot of those things. So, so it would be a specific project while at the same time kind of seeing the more senior individuals actually in action.
Okay, thank you.
You got it.
Hi, I had a question. My name is Napuna. I'm a sophomore mechanical engineering and design major. You actually mentioned about design and refinement of the user experience for Regeneron products. And I was wondering, because myself and some other people in NSBE are also interested in that, what program should we apply to for internships? As a mechanical engineer, would I apply to mechanical, or is there like a design specific program I should apply to?
So it's funny you say that, because like that group that Juliet is going into, generally it's like a BME, but a lot of times it's a MECI with that design, because it's we're making these biologics. Well, we have to have a delivery system. There's got to be a way for those biologics to get into a patient. So it's right now it's called PSDPE, or Process Sciences, Drug Product Engineering, and that group is vast. Now it encompasses so many different elements, and that's probably the group that you would end up in, but you would apply to that MECI major, and from there, because that's if they're looking for, again, because it's project based, there are going to be probably between 5 and 10 projects that are going to be a little bit more geared towards that design element within MECI. Sure. I'm sorry if you guys are hearing a ruckus. It's I have a 2-year-old at home, and it's tub time, and the tub is literally right above where I am. So it's a little bit of clatter. The fun of working from home.
I had a quick question, if I could ask one.
Go ahead, Christian.
Thank you. So I was wondering, so in my case, I'm pursuing a dual bachelor's and PhD. I'm part of a accelerated BS PhD program here at RPI. And I was wondering, do you guys have like a different, because I know Tarrytown is based more around that PhD research.
Yeah.
Is there also a difference in the like the pay for the PhD students that come in difference to like master's students that go in or bachelor students that go in? And yeah, that's basically my question.
That's a good question. So we do have projects at both locations that are for various different levels of education and for different programs, right? So they may have more PhD oriented roles there, but like we have a QC virology group that we do get a lot of students that are on a PhD track that end up landing in the QC virology group. With respect to pay, the way the pay is done is it depends on how much education has been completed. So you could be in a PhD program, but if you're still working towards that bachelor, you might be, a third year in the bachelor's. That's the rate you would get at that time. But if you are, if you've already achieved that bachelor's degree, then it's a different rate, right? And the same thing like down in Tarrytown, they have a program called Build, which is specifically geared towards MBA students. Those students are paid a little bit differently than the traditional track of how much education is completed.
Okay, thank you. Thank you.
You got it. Yeah, I mean, so aside from the fact that they are paid for students that are for 2021, we don't know exactly what it's going to be yet. When I say on-site, hybrid, or fully remote, right? So there's just too much uncertainty as to what's going to transpire. But if it is going to be on site, then there's the additional, there's a housing stipend as well. We would be able to provide you with some financial assistance for the time that you're with us, the minimum of 10 weeks roughly.
Thank you for asking me my question. Appreciate it.
You got it, Christian.
Hi. Can you hear me? Oh, okay.
Yeah, go ahead, Maverick.
Okay, thank you. My name is Maverick Bio. I'm a biomedical engineering major, actually hoping to maybe get a position at Regeneron soon. I just wanted to ask more about like the interview process. I know you talked about how the first part of the process is usually a video where you record yourself. What do you guys usually look for, and can you speak a little bit more to that process?
Yeah. So, well, actually, Maverick, but before I do that, when you say you're looking for a role, are you looking for full-time or are you looking for an internship?
Internship. I'm probably doing my co-term, so I'm probably going to get my master's here. So
perfect.
Just in that time.
Okay, very good. So because the full-time process is a little bit different than that process for an internship. So as an intern, what are we looking for in those video submissions? So you think about, submitting a piece of paper, a resume, it's just a snapshot of maybe what kind of skills that you have. It doesn't necessarily tell us like who you are, what you're passionate about, how you're taking full advantage of that college experience. So we talked about the Regeneron way, right? So, Maverick, many things, what I'll be looking for in those videos is like, how is this individual demonstrating that they would be successful in that Regeneron way? Are they talking about their exceptional, the teamwork or project work that they've done at college? Are they talking about work, actually, maybe I have employment, I'm working my way through college. I'm heavily involved in student activities. Maybe, like I know Dr. Jackson over at RPI puts a lot of emphasis on like student athletics. Maybe I'm a student athlete, things like that will definitely come out. But also, like I was talking about with answering one of the questions before, is there's that, like passion and enthusiasm doesn't come through in a resume. So, that's the kind of stuff we want you to be yourself in those video interviews. And honestly, if you're passionate about the science, if you're passionate about, really, helping people, that's going to come out naturally during some of those interactions.
Thank you.
You got it. Yeah. And so Matt, we're going to get, so the full-time process is a little bit different. So they don't utilize those video interviews. They actually, it's a live interaction each time. But just because of the nature of our timeline and the volume that we have to work through, that's why we've decided to use those video interviews at that first stage. Oh, anybody else?
I have a question. Oh,
Go ahead,
sorry.
Mary.
No, it's so great to hear. Go ahead. Okay. My name's Tahira. I'm a senior chemi here at RPI, and I actually already applied for internship position because I also plan to get my co-term in chemi, similar to Maverick. My question was about diversity at Regeneron. So, as a member of NSBE and also just as a Black woman, I'm wondering how the spaces are at Regeneron inclusive, making sure everyone has a voice at the table, and then also just representing in general.
I appreciate the question, and obviously it's a huge topic right now, right? I mean, so what I can tell you, there's a couple of things to think about when you think about that at Regeneron. But what I would also say to you, and not just for Regeneron, but like do your due diligence for a company, right? You know, because there's a lot of things that are being said right now. In some cases, it's literally to check a box, right? So it's think about what kind of questions that you can ask to get that authentic response. Okay, so for us, I can tell you that for one, our MO is doing well by doing good. Okay, you know, it's always been doing well by doing good, and so we know that there are significant opportunities out there to be able to improve the diversity of our workforce, right? So we are making significant strides both internally as well as through the recruiting element to try to expose our organization to, you know, various, you know, whether it be women in engineering, whether it be you know, like we obviously like Society of Women Engineers, or whether it be OSTEM, or whether it be the National Society of Black Engineers, you know, this event activity, right? So that's just one element of what we do. But when you're talking about what's going on inside an organization, we have employee resource groups. So we have ERGs and EIGs. So everything from WISER, which is Women in Science and Engineering at Regeneron, to HOPE, to RE-LGBTQ, to our Black ERG, which was really just launched by our new DE&I office. So it's an exciting time to be a part of Regeneron because you can help guide some of these efforts. I used to work for Progressive Insurance, and I was a board member for our Latinx. So at the time it was the Hispanic ERG, and it's amazing how when you're talking about diversity at an organization, it's not authentic unless it's driven by the employees, right? It cannot be like leadership saying, "Oh, you have to do this." It has to be bought in. So what's going on right now is we're sending out some surveys. We're asking people who would want to be actively involved in doing some of these things. I can't tell you how overwhelmed how overwhelming the response has been from our employee base about people wanting to get involved, whether it's volunteering to mentor people, whether it be wanting about getting involved in the community, whether it be about playing roles in these ERGs. So I can tell you like that is one of the great things about Regeneron too is that we had like I was talking about with the Regeneron way, that was driven by the employees. So everything that's going on within the realm of diversity right now is being driven not by leadership but by our employee base. But again, so I can show he obviously a gentleman who is a person of color came in from Penn State. Actually, can you talk a little about your experience as an employee at Regeneron?
Yeah, I was definitely gonna interject afterwards.
Yeah.
Just going off of what he was saying right now. There's definitely a lot of companies like just trying to save face, just trying to put that figure into the position on the board or whatever. Just say, yeah, we're standing up for diversity and inclusion, Black Lives Matter, minorities matter, etc. But for me personally, I'm from Philly originally before I went to Penn State, then moved up here to Albany, New York, which I never thought I would be in. And moving up here, being up here, it's been different, but I've kind of found my place due to Regeneron. There's never been a time where I felt out of place, where I felt I couldn't speak about how I felt about something. Or even right now, with people in my team and other people in clinical, it's always been open discussion, stuff like that. I've never been the type to be shy about like, you know, speaking about like being of color and like how I feel about stuff going on in the world. And people like sometimes don't know things, and like here at Regeneron, don't ask me like questions. I'm never shy about that. Like they're always respectful. And then as he was saying with like Regeneron's approach right now, one of our like senior leadership like managers, a couple workers came together, like just started off as a discussion and just like progressively move toward like how we can make change in our company to move forward, you know, like get more people of color that like also suit the Regeneron way. Therefore, just to push forward our company to see like more people wanting to come in, more people feeling comfortable. And it's just been nice to see like how many people wanted to come out before, because I remember my first career fair that I did, just because personally when I first saw Regeneron and at the career fair at Penn State, I didn't see anyone of color. So when I came into Regeneron, I was like, I want to be able to go on those career fairs. I want people to be able to feel comfortable, like when they go to that career fair, not to be like, oh, this is all I'm seeing here. There's like no type of representation of us. So just to be, you know, that face there to try to get people that, you know, are talented, are smart and stuff, but may not have like felt that presence, just to, you know, give them that step forward to go towards. But definitely the culture is there, and you know, it's welcoming, so shouldn't feel shy about that.
Alex, do you mind if I say something quick too?
Yeah, go for it.
I was just going to say, so Regeneron on our homepage, like the employee homepage, has just started, it's a series called Let's Talk.
Oh, yeah.
And they're these cute little cartoons, and at least the last one that I watched was about dealing with uncomfortable situations, and whether the topic be race or background, religion, sexuality, like any of those things. So I watched that and I really enjoyed watching it. They made it like really fun to watch and not uncomfortable. And then my team actually, like my little team within QA, blocked off an hour next week to just sit and reflect on it and discuss it, which isn't any mandatory anything. So like Alex was saying, it's not just checking boxes. Like those are important conversations to have, and a lot of the problem does stem from avoiding it rather than talking about it. So Regeneron as a whole is doing a really good job about like teaching us how to talk about things that might make us uncomfortable.
Yeah, I mean, there's not like it's not a one right way to do things, right? You know, so there's you have to lay the groundwork. You have to have the right genuine motivation. You have to be able to educate people, not only your workforce, but people that are coming in. So like right now, as a manager, I'm going through all these like LinkedIn learnings. So like the one for diversity right now that I'm watching is Cohen is her last name. She wrote the book White Fragility, right? And it has to talk a lot about like white privilege and everything. And it's eye-opening for us as employees, while at the same time, you know, it does put you in those situations where it's like, okay, in order to actually move the organization forward, you know, like Anik was talking about, we have to have those uncomfortable conversations. So you know, they've been extremely valuable to me, and I'm appreciating even more and more the organization's approach for the way that they're going about things.
That one yesterday, Alex, I watched the LinkedIn Learning you're talking about, and she even said like the way she was structuring it was made to make us feel uncomfortable. She said like she's saying things that normally you would like to get defensive about and say, oh, I don't think this way. She's like, but we all inherently think this way. She's like, it's just finding a way to deal with it and talk about it. So,
and actually to I can show this point before about like representation at a career fair. So, you know, we do RPI, we do Clarkson, Binghamton, all the, you know, lots of obviously engineering schools. And I was talking to a woman, a student at Clarkson, and she, you know, she happened to be, you know, person of color. And we were doing an info session, and she's like, you know, I never felt comfortable going to a career fair because, you know, I looked around and there was nobody that looked like me there. And I just felt like I wasn't accepted. I wasn't desired by these organizations, and I like it made my heart sink. You know, like I guess it was like one of those where I had a real gut check and looked in the mirror. I'm like, okay, as a white male, I've never really felt that, and that needs to change. So, working very closely with that group that Akinshela was talking about, as well as just really educating our talent team, our human resources team, because again, this is not like here's the other thing is like so recruiting, right? So if I go out and right now we're talking about diversity, but it doesn't necessarily have to be diversity, but maybe it's interns, right? So I recruit Annika to come to do an internship at Regeneron. She comes in, and maybe it's female. Maybe she comes in and she's like, crap, this place sucks. I hate it. They treat me like garbage as a woman. And then what? She's gonna leave the company, and then she's gonna go back out into the community, and she's gonna talk to her network about what a horrible experience that she had. That's not gonna help us any, right? So you have to have the appropriate groundwork laid, and you have to have the right culture, like Akinshela was talking about, to feel welcome before you can even do anything like that, right? So it's very multifaceted. It's very detailed and involved, right? So, but I would say that this organization is genuinely trying very hard to make a conscious effort. The other thing is, you think about what do we do with our company? We're an organization that's driven on innovation. So if you don't have people that are coming from various different perspectives of thought, you're not going to get very far. So it's really, you want to have an extremely diverse talent force to be able to really come into to challenge each other's ideas and to look at problems from a different lens, right? So, not only is it the right thing to do, but also it's the right thing to do for the organization to continue to grow.
Thank you.
You got it.
I have a quick question.
Go for it, Miriam.
I know that I'm really a people person and very passionate about anything I do, but being at college, I'm really trying to find what exactly I want to do. And recently, I think I want to do something that's making things more efficient, and I really would like to apply to Regeneron with an internship, but I was wondering what time would you do you know if your next set of internships for the next year are coming out? Because I think I want to get more classes under my belt before I go out and test it in the field.
So you're saying like maybe the summer of 2022 is when you would be looking for? Yeah. So every year we post our positions roughly the end of August, like 1st of September, and we would keep them open through like the beginning of November. So, but what I highly recommend is like hopefully in the spring I would love to be on campus. It's great to be able to see you guys on these little screens, but I'd really love to rather see you in person and shake hands and say hi and answer questions on an individual basis. So, but I'd recommend coming to see us and talking to us more then, because we might have a better understanding for what that forecast will look like that following summer. So when you talk about like increasing efficiencies and that's all we a lot of what we do is how can we get our products to our patients not only faster but safer, right? So it's and continuous improvement is not just a term, it's actually a department at Regeneron. So we do have interns in CI regularly, and a lot of that deals with helping other departments come up with efficiencies. So definitely let us know, because I should say definitely stay in touch. And I think that Emmanuel had put in the link for how you can join our talent community, right? Like it's basically like doing our, and let me see if I can pull it up. This would allow us to keep in touch with you guys proactively following the event, okay? So let me see if I can just track it down here.
I found it. You don't have to worry about it.
Okay. It says Avature in there somewhere. Yep, there we go. Thank you. Thanks to hear. All right, I know we're running long, so does anybody else have any questions?
Yes, I actually do.
Go ahead, Timmy.
Yes, hey everyone. My name is Tamia. I'm a current junior at RPI, dual majoring in industrial engineering and mathematics, and I applied for the IOPS internship for next summer. So the questions I have, I actually have a series of questions, and these are geared towards the interns in particular. So I know that you guys have like touched base upon like what you have done this past summer. However, I kind of wanted to go more in depth. So I'm gonna ask all these questions at once, and then whichever like format that you guys want to answer is fine. So the first one is, one, did you work on one or multiple projects this past summer? Two, were you working with other interns or with your employees, like your supervisors? Three, what was expected of you as a deliverable each day, such as like if you had like a Gantt chart, stuff like that. And then also, were you part of any of the ERGs, such as Wiser, like Alex said before? And then 4 or 5, how was your performance evaluated? Did you have a mid or an end internship review?
Juliet, do you want to talk first or do you want me to?
Whichever you prefer. I can talk first if you want.
Okay, go for it.
Yeah. So let me know if I miss any of your questions, but yeah, so I mostly worked on one large project, which was my work instructions, and that's what I mean, it was sort of like a lot of different things into one sort of main objective. So I did a lot of different things, and I actually did talk to other interns, but you also have the chance to talk to other departments potentially, and you definitely have to, and you're definitely able to talk to different higher ups and different people in the company. So it's not strictly with other interns like in many companies. You definitely get to network outside of your group as well. And we did have midsummer evaluations, so that you sort of have like a midsummer evaluation to see how you're going and if you're reaching all expectations, and then sort of like an end summer evaluation as well. But the midsummer evaluation is nice to just get in touch with your manager and just make sure you're reaching all expectations. On a daily basis, I think specifically for my group, we had bi-weekly meetings. Yeah, so 2 meetings a week. One was with my manager, and we pretty much went over everything I did that week, and the other one was my manager and actually my manager's boss. So we talked about everything, and that was with the other interns and my team as well. So we pretty much sort of gave a brief little PowerPoint of what we did that week, and we went over it. Did I miss anything else? I think I probably missed a couple.
So to me, you did ask about like Wiser and EIGs as well, right? So actually, all of our interns, and this is where like being remote kind of sucked, because when you're on site, there's a lot more perks that you can take advantage of. All of our interns are treated like full-time employees, so they do get to take advantage of all those perks. So like, participating in EIGs, ERGs. We have tons of like sport teams. We have like gyms on site. All that, like our interns normally have access to all that. Like we have like free food and free coffee all day long. They call it like the Regeneron 15. It's no joke. But that's what, like being remote would like kind of like, just like you guys know, like with RPI, there's certain perks about being on campus, right? So, but normally they would have absolute access to all that stuff.
Yeah, I was gonna say, similar to Juliet, I had like a check-in every other week, and it was with my manager, my manager's manager, and his manager. So like 3 different levels above me. Then I had weekly check-ins just with like my team. And I also only worked on one project over the summer. And it was just by myself. Like I didn't work with anyone else on it, but my manager had another intern who I became super close with. She doesn't work there anymore, and we still talk all the time. So you definitely make relationships with a lot of other interns, whether you're virtual or in person. I'm sure would be even more so.
And to me, some of the projects are specifically structured so that they're like a little bit more independent, like Annika was doing, and some of them are a lot more set up so that you're actually structured to work in either a group or partnered up with another intern. It depends on the department and the specific project. Yeah.
Oh, something else I can touch on is, you said working with like full-time employees. So we do presentations to like our entire department. So that was really cool. And then we do the poster expo, where the poster was the most satisfying thing in the world. It was like my entire project condensed onto one page, very visually appealing. So people stop in and they see that. It's a really cool way to connect to people that are higher up, maybe don't have a lot of time to talk day to day, or even people across different departments. So
yeah, we did the poster day virtually this year, and there was awesome content. Just unfortunately, by that time, it was like, everybody was like 5 months into COVID, and there was like a bit of that COVID fatigue. So it was tough to get a ton of presence. Normally, when we do it in person, we have like 800 people go to it. Not only is it great for the students to showcase the great work they're doing, but it's an opportunity for like a great knowledge share, because like, you might be doing some work in one department that could actually have an impact in another department, and all of a sudden they're walking like holy crap, like that's awesome, that's really going to have an impact on what I'm doing. So it is, but to Annika's point there, like consolidating 8-10 weeks worth of work into a poster, and like just throwing it up there on the board. It's pretty. They all look really cool. They do a tremendous job at the end of the year.
I'm just going to unmute myself real quick for Fiona. If you want to, oh, sorry, you messaged me privately, but if you want to like connect with me on LinkedIn or anything, I'd be happy to chat with you sometime.
Thank you.
Oh, I had one quick question. So I've heard you only mention summer internships. Do you offer ARCH internships during the semester, like for ARCH students?
Good question. So you did not hear this from me, but we have an agreement with the ARCH department there that can allow the students to get an exemption. Because we hired 26 RPI interns this past summer just in our location alone. So, I love RPI. I'm not, I understand the reasoning behind the ARCH program, but I also think that the students should be allowed a little bit more flexibility. So we were able to get that. I mean, especially considering the whole COVID situation, how many companies can really dedicate the resources to a full 5-6 month co-op? So with that said, I do have to shed some light on the fact that our wonderful friends down in Tarrytown, we do have co-op opportunities down there. So both in the spring as well as in the fall, roughly about 40 to 50 or so that would be starting in January.
Thank you.
You got it. Anybody else?
I had a question about the stewardship opportunities or initiative. Regeneron has a whole page dedicated to how it's decreased waste and water management and its energy output. I was wondering if you guys were sort of passively intaking renewable energy, or you had any interns or engineers going towards the energy sector.
That's a good question. So is that Christopher? Chris?
Yeah.
Yeah, so that would actually be a part of 2 different project groups. So there's EHS, which is Environmental Health and Safety, and then there's just a specifically group. It's called Engineering, which falls under our facilities organization. That they are for the summer of 21. They will be working on things like that. So one of them actually has to do with our wetlands. So we have like 4 major campuses in the area, and we have like sprawling land all around that. So one of them has to deal with the watershed there, and the other engineering one has to deal with. I think it has to deal with our parking structure. So we have a very large parking structure for our contractors that is fully sustainable. It's completely powered by solar. But they're going to be making some adjustments and additions to that, and I think that part of the intern for that group is going to be working on some of that project.
Okay, thank you.
You got it. All right. Well, it looks like it's quieting down, but first off, thank you guys so much for welcoming Regeneron to this conversation. I believe that we have another session set up for next week that I'm going to be doing like some LinkedIn stuff with you guys. So so many people, they think that LinkedIn is just like it's a resume out there, and that's really the only purposes of using it. Well, I'm going to walk you through some things to be able to really emphasize that there's just so much more to LinkedIn than just that. Okay, so really allow for your professional development. But a huge shout out to Akanshola, to Annika, to Juliet for participating in this today and for sharing your insight. Emmanuel and Fiona, thank you guys for helping to coordinate all of this. It's again, I know that it sucks for you guys right now. I don't envy the situation that you guys are all in. Trying to go to school in a remote capacity. I try to complain. I complain periodically of doing this at work, but I could not imagine being a student in this. So my heart is with you guys. I absolutely wish you the best in this current situation. At the same time, I also say, hey, be safe, take care of each other, stay away from each other. Do what you can to help us, make a strides in reducing the spread of this thing, and hopefully, the next time, maybe not next week for LinkedIn, but maybe the next time that we're able to do a session with NSBE, maybe it can actually be in person. All right. So I wish you all the best, and have a wonderful rest of your week and weekend. All right. Thank you, guys.
Thank you.
Thank you.
Bye-bye.
Thank you.
So moving forward, we like to thank everyone from Regeneron for coming, but please don't leave just yet. We do have announcements. So I'll go through it as quickly as possible, and I'll share my screen so we can get to it. Is Muhammad here? If not, I'll just announce it myself. So NSBE has started a community initiative for NSBE Cares. So you'll get rewarded for community service projects you'll do on your own throughout the course of the semester. And hopefully for those who are in first and second place, you'll be able to win a prize. So keep posted on it. Hopefully we'll be able to release more information as the semester progresses. As a reminder, we have our coffee chat so you can get to know our fellow e-board members outside of their positions. And you can talk about NSBE and non-NSBE subjects and receive general advice as a whole. And we host them on Tuesdays and Thursdays from 8 to 10 p.m. Eastern time. So please show up so you can get to know us. We're human too. So it's another great opportunity. Also, again, reminder for our membership. If you decide to become a paid member, some of the benefits are you have access to a VIP Discord chat, free swag, resume book, and you also have access to companies. It only costs $5 and it will last you for the whole academic year. If you're interested in paying, the QR code is on the right side of the slide, and you can pay by Venmoing the username that's shown, and please include NSBE RPI membership name and email. In addition to NSBE RPI, we also have activities on the zone level. So this is your chance to apply for Upstate New York Zone Executive Board. The open positions are Vice Chairperson, Secretary, Programs Chairperson, and PCI Chairperson. The application deadline is rolling, and if you're interested, please contact Jalen Edmonds, who's the Upstate New York Zone Chair, at the email that's shown on the screen with any questions, because who goes to RPI, so he's definitely a great resource if you're really interested and want to get yourselves involved. As another reminder, similar to committees on the chapter level, we have committees on the regional level as well. We'll be able to committee chair and members on initiatives and programs without the commitment of having a regional position. And so far, the committees that are open are Fall Regional Conference Planning Committee and Tours Committee. If you're interested, scan the QR code. Again, it's another great opportunity. So take advantage of it if you're interested. And we have our Fall Zone and Regional Conferences. Fall Zone Conference is next week, and Fall Regional Conference is next month. Please fill out the letters of intent. For Fall Zone Conference, it is due on Saturday at 11:59 p.m. And for Fall Regional Conference, it is due on the 30th. Again, there's going to be a career fair at Fall Regional Conference. A lot of companies that are going to be showing up. Great for internship, full-time job opportunities, and you'll be able to network with different people within your zone and your region. So apply. We want to see your applications. And also we have the 47th annual convention, which is in mid-March. It's currently scheduled to be in person in Orlando, but I don't know, given uncertainty, if that's going to happen. And the theme is the holistic engineer. Similar to the smaller conferences, you'll network with people from across the country and the world. And there's also a career fair with a lot of companies who are going to recruit people and members just like you. So we don't have any official updates yet, but we'll keep you posted. So just keep paying attention. We'll be able to give you guys updates.
I guess I can do this one. Join the Facebook group. I don't have the link right now, but I will put it in the Discord in a little while. But stay in touch. hopefully we could go to conference, but we'll have events in like Facebook event in NSBE RPI Facebook group. So if you see it pop up, just you can click that you're going. That would be really nice. And then stay in touch Discord server. All of you are already in that already. Once again, great job. And then make sure to follow us on Instagram at NSBE RPI and on LinkedIn. You can join the group. For Instagram, if we have an event coming up, we'd love to see you like post it in your story or post pictures during the event, just to make sure that you guys are having a good time and enjoying everything that we're offering. And then check your emails every Sunday.
I'll talk about NSBE points again, just real quick. Any event that you attend that's NSBE related, even like today or other workshops you do, you get NSBE points for attending. And if you're a paid member, you get even more points. So that's incentive to become a paid member. So you can volunteer for a NSBE event, attend resume reviews, etc., other workshops. So yeah, attend as many as you can, and you get more perks at the end of the year, like scholarships and stuff.
So coming up, we have a PCI workshop for manufacturing that Chica is going to be leading, and the rest of the outreach committee as well, on October 27th, which is Tuesday, maybe. That sounds right. Tuesday is going to be a Regeneron LinkedIn workshop, so what Alex talked about a little while ago, and then our next GBM is going to be 2 weeks from today, talking about interdisciplinary engineering careers. So how you can apply like your engineering skill set to other factors outside of engineering, but still having that core engineering center. And then as a reminder, study jams on Wednesdays from 7 to 11 in the Discord voice channels.
Quickly to here, let me interject real quick. Also next week, I know it's not here, but just keep your eyes open for a potential info session for the conferences coming up in case you guys have any questions. I know it's different this year being online and everything. So I'm just gonna help inform you guys and let you guys know what's going on. So keep an eye out for that sometime early next week.
So the quote of the day for this meeting is, if you want to achieve greatness, stop asking for permission. I won't like elaborate because we're short on time, but it's sort of like you're the person who grants access to the opportunities that come to you in life. In this case, professional opportunities, and you guys took that next step by attending an information session by Regeneron, and hopefully, if all goes well, you'll be able to you may receive an internship or a full-time offer. So, don't hold yourself back. And don't ask for permission from like others, and you like take advantage of the opportunity. And on behalf of the NSBE RPI Executive Board, we'd like to thank you for coming. We hope to see you at events. We do not want this to be the last time that we see you guys. So again, thank you for coming, and have a great night.
Bye, everyone.